health insurance companies out there. When Humana applies, this is one benefit, when Humana applies the women's preventative benefits into a plan, or if the group chooses to add the benefit, it could result in an increase in that group's premiums. Here's another one from Blue Cross. This was actually released the day that the Supreme Court upheld the individual mandate. We will continue to implement the health reform law while working on policy makers to fix provisions that will increase costs, such as the health insurance tax that will add hundreds of dollars to families' premiums each year. So again, more coverage plus more people is simply just going to equal more money, and these insurance companies are letting us know right now. So let's talk a little bit about the expectations that are going to come from the law. Doctor shortages is going to be huge. The American Academy of Family Physicians has already predicted a 40,000 primary care physician shortage. And then the Association of American Medical Colleges said that by the time 2015 hits, we could see a deficiency of 62,000 doctors. And then because of that, we're going to have longer wait times at the doctor and hospital. The insurance premiums will just continue to rise. We're going to have increased bureaucracy and paperwork. So just to give you a quick example of that, as a volunteer service, I have assisted a few people with their application to the new PCIP plan. And what that is, for you that don't know, that is a pre-existing plan that the government put in place for people who had pre-existing conditions. So at a minimum, the process takes 2 months from start to finish. So just to give you a reference, in Louisiana, an individual application can literally take 24 hours up to about 2 weeks. So now that the government is involved, I guess you can say, it takes 2 months. And then over those 2 months, I made 32 phone calls and I sent 17 emails. Out of the 32 phone calls, I had 6 calls returned, and none of them were from the same person. It's all over the place, completely all over the place. More hospitals and providers are going to pull out of Medicare. So in 2009, the Mayo Clinic was named the #1 hospital in the United States. And just 30 days later, they made the announcement that they were going to be opting out of Medicare due to program spending cuts. So as you can imagine, it's going to start happening over and over.